Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Stimulating the reward center of the brain with electrodes may provide some relief for individuals with treatment-resistant obsessive-compulsive disorder, according to research published in the Archives of General Psychiatry. Here is some information about deep brain stimulation. It is a treatment in which electrodes are surgically implanted deep into a specific area of the brain. Electrical stimulation is then delivered to this area of the brain through these electrodes. It has been studied as a treatment for several neurological and mental disorders, including Parkinson's disease, depression, and Tourette syndrome. Researchers from the University of Amsterdam implanted electrodes into an area of the brain known as the nucleus accumbens in 16 individuals suffering from OCD that did not respond to standard therapy. The area is part of the brain's reward pathway. The participants then received stimulation in this area of the brain for 8 months, in addition to cognitive behavior therapy. At the end of 8 months, the participants received stimulation for 2 weeks, followed by 2 weeks without stimulation, or vice versa, without knowing when they were receiving the treatment. Finally, the participants continued with active deep brain stimulation for 12 months. During the initial 8 months of treatment, participants' scores on standard OCD rating scales decreased by 46%, and 9 of the 16 patients were considered responders to therapy based on the degree of symptom relief they experienced. During the next phase of the trial, scores on the OCD scale were 25% lower, while the participants were receiving deep brain stimulation compared with when they were not. The participants also experienced substantial drops in depression and anxiety. We had a chance to speak with Dr. Demian Denise, one of the investigators of this study, who offered some further insight.
The brain stimulation, or DBS, is a technique where you implant 2 electrodes in the brain. They're attached to a battery and they deliver continuous electrical activation of very specific brain areas, in our case the nucleus accumbens. By stimulating these brain areas that are involved in the neurocircuitry of OCD, we can really decrease the major symptoms of obsessive-compulsive disorder. These symptoms are obsessions, of course, thoughts that come up all the time, compulsions like washing your hands and so on, anxiety, discomfort, depression. We did a study in 16 patients, and with the stimulation of the accumbens, that particular brain area, we managed to decrease the symptoms in the majority of the patients of approximately 75 to 80%. So you have to imagine that when you have OCD and you, for example, you wash your hands for over 8 to 10 hours a day, with this technique you can minimize these particular complaints and the hours of washing and things and thoughts and so whatever, so to approximately half an hour or 1 hour a day, which is a huge improvement and a major change for this patient group.
Today's research highlights the potential role for deep brain stimulation in the treatment of serious mental illnesses that do not respond to standard treatment. Deep brain stimulation is still considered a treatment of last resort. If you have persistent symptoms of mental illness, speak with your healthcare professional. For Insider Medicine in Depth, I'm Dr. Susan Sharma.